I'm Dr. Sandy Taylor. I'm a veterinarian, and I own LakeShore Veterinary Clinic. I became a veterinarian because of a lifelong curiosity as to how things work. I was a child that was allowed to have an ant farm. I was a child that had cocoons in my room. I was given every opportunity to explore outdoors, and that gave me this sense of what life is about, how to be inside things that are changing all the time, and veterinary medicine gave me that ability to help solve puzzles, to be able to identify things that weren't right, to be able to help make things in a better way. This veterinary clinic began sort of humble beginnings with myself, a technician, and a receptionist. In the beginning, I wanted a place where animals felt safe and secure, and where we could reduce as much fear as possible. LakeShore Veterinary Clinic is a place where we offer fear-free examination, and that is to become certified by a program. So every employee of my clinic has taken all the exams that allows them to identify different stages of any kind of fear, insecurity, or anxiety in a pet. I'm very proud of my clinic because we are fear-free certified, and we have to be recertified every 3 years with continuing education. We are also a member of the AAHA, which stands for AAHA, American Animal Hospital Association, which have very strict standards in order to qualify. And again, we have to be recertified. And because we have a separate feline examination room, we are certified feline-friendly gold from the AAFP, which is the American Association of Feline Practitioners. I'm very proud of those. It makes our quality of medicine very high, and we're probably the only clinic that includes that or has those certifications within 100 kilometers. So I'm very proud of that. Registered veterinary technicians are very similar to what a nurse would be in human medicine. Our technicians at LakeShore Veterinary Clinic have worked hard, done extra training and courses. 2 are certified in canine rehabilitation therapy. Others are working towards other certificates, some with nutritional counseling, sometimes behavior, sometimes feline medicine. They all are expanding their boundaries even further with education, and I know what intelligence and strengths that they have, and I encourage them to do this. We're also qualified in pain assessment, so the patient will get a pain scale. By that, we can offer multimodal medicine, as well as physical therapy, as well as acupuncture that helps our pet populations. Morals and values of our clinic are based on kindness and respect. I believe the strength of our clinic comes from those values, that when we enter an examination room, the pet is seen with compassion, empathy, with kindness and respect, and the way we listen to understand what that pet is feeling from their caretakers is the best way to treat that pet. For us to provide quality medicine, our understanding of the problem is of utmost importance. Very, very strong themes throughout everything that we do, whether it's the pet or our client or our fellow workmates. I believe the biggest strengths that we have are how we communicate to our clients and how we understand their own fears and anxieties and the needs of themselves as well as their pets. A caretaker and their pet, when they come in our door for the first time, would be greeted by our front office staff, who then are evaluating to see if there's any is the animal afraid to get on the scale? Are they nervous about other dogs? Or asking questions about preferences? and that will be relayed into the file under the emotional medical record. When they enter the examination room, a technician comes in to ask history, ask questions. The technician will then go to the doctor, who is to examine the animal and relay any pertinent information, as well as this animal might be a little bit nervous, it's okay, does like treats, responds to vocal sounds like, oh, treats, and their ears will perk up, little things like that, so that we just don't walk into a room and make an animal nervous. I ask my staff to give me different words to use to describe our clinic. One of my technicians said, say we're vivacious. These are some words that they said had been relayed to them from our clients. Trustworthy, knowledgeable, compassionate, expertise, kindness, friendly, caring, and attentive. And I just was bursting with pride and gratitude that what I envisioned as my clinic was able to be brought to fruition. Feel free to give us a call or send us an email. We look forward to hearing from you.